Hey folks, it's Dr. Sam, and I received a question from a colleague. She is struggling with a blocked tear duct. She's had that about 5 years. She also develops watery eyes and mucus, and she's had a surgical consult from two really excellent surgeons. But the success rate, according to them, is about 30%. So she's struggling and she wants some advice. So here are three suggestions. Number one, I would work on hydrating the eyes during the day and in the evening. When there's a lot of tearing and mucus, this suggests that she's not producing enough tears. And the way to remedy that would be to start using homeopathic eye drops and MSM eye drops during the day, and then using some type of plant-based compresses in the evening. Now, this could be the chamomile fennel tea, which I talk about, or eyebright tea compress. You could even do rose petals with an eye cup, but she needs more hydration and at the same time reducing any inflammation in the eyelids. She could also massage the eyelids with an organic castor oil in the evening. And this is where the manual therapy comes in, where you're massaging where the tear duct exists. And castor oil is great for the skin. It also is an anti-inflammatory agent. Plus, you are massaging into the area that's compressed or constricted. Number two, I would seek out either a lymph drainage therapist or a craniosacral therapist and do some manual massage around the eyelids and the blocked tear duct. You know, as a craniosacral therapist, I do a lot around the eyes in terms of opening up the tissue, the circulation, and it does wonders when you do light massage and manual therapies in and around the fascia and connective tissue in the eye area. The third thing I would offer, and this is a little bit outside the box, but in studying somatic therapy for many years, I understand the value of making sound and putting sound into the tissue. And there are a couple of sounds that we use in our classes. One is called the hum, so it's the end palm hum. That's on my website. There's another one where we use the theta breath and we make spirals around the eyes and around the eyelids. And there's a third sound I like to use called the jacques. This is like a buzzing sound, zzz sound, where you can put this into the tissue and it's really opening for the fascia, the connective tissue, and any place that's compressed. You know, holism means to me that sometimes you do have to include pharmaceutical drugs and surgery in terms of the eyes. And there are times that I will refer for eye surgery, and then we just do a lot of physical therapy and complementary integrative things after the surgery. So in the end, you may need to consider the surgery and then have in line all the integrative things that you will do to help you heal. So I hope that's helpful. It's a great question. Take care.